Cardiomyopathy by Taylor Harris. The objectives that we will learn in this presentation slide about cardiomyopathy include: what is cardiomyopathy, the causes of cardiomyopathy, risk factors of cardiomyopathy, symptoms of cardiomyopathy, problems that can result from a prolonged cardiomyopathy, when should you see your physician, living with cardiomyopathy, what we will do as a nurse, and how to prevent cardiomyopathy. So, what is cardiomyopathy? Well, basically, cardiomyopathy is the term used to describe diseases that can affect the heart. These diseases can also enlarge your heart muscle or make it thicker and more rigid than normal. In rare cases, scar tissue replaces the muscle tissue that's there, and that makes it harder for the heart to pump efficiently. There are all different types of cardiomyopathy, but the most common three are dilated, hypertrophic, and restrictive cardiomyopathy. The heart can become increasingly weaker as cardiomyopathies continue to progress, and also less able to pump blood through the body and maintain a normal electrical rhythm needed. This can lead to heart failure or irregular heartbeats, and that's called arrhythmias, which is why early detection of cardiomyopathy is extremely important. The causes. So, the exact cause of cardiomyopathy is unknown. However, the risk factors on the following slides have been found to increase the chances of developing cardiomyopathy. The gene for cardiomyopathy can be inherited or acquired. Hypertrophic cardiomyopathy is inherited, while dilated cardiomyopathy is also inherited and can be exacerbated by viral hepatitis, thyroid disease, or HIV. Risk factors. So, the risk factors for a person to get cardiomyopathy include people who have inherited the gene for the disease, have coronary heart disease, have a history of heart attacks, have had viral infections that inflame the heart muscle, have diabetes, have severe obesity or any type of metabolic diseases, have prolonged alcoholism, or prolonged hypertension. Symptoms. So, symptoms of cardiomyopathy that may lead you to go call your physician include fatigue, coughing while lying supine, chest pressure or discomfort, and that's chest pressure or discomfort out of the normal daily chest pressures that a person can experience just by eating and lying down or having gas or anything. Fainting with bouts of dizziness attached, pounding heartbeats, breathlessness at rest or upon exertion, or leg, ankle, and feet swelling, as well as feel fluid buildup inside the abdomen. Signs and symptoms tend to get worse unless they're treated. In some people, the condition worsens quickly, and in others, it may not worsen for a prolonged period of time. When to call a physician? You need to call a physician when symptoms are continuously felt for more than 2 months. A cardiologist will be involved in diagnosing the specific type of cardiomyopathy, and an in-depth physical will be performed. An EKG, chest x-ray, stress test, and Holter monitor can all be implemented depending on which type of cardiomyopathy you may have. Living with cardiomyopathies. Surgically implanted devices, surgery, or medications can all help a patient live with cardiomyopathy. Controlling your signs and symptoms so that you can live as normally as possible, managing any conditions that may cause or contribute to the specific cardiomyopathy that you may have, reducing complications and the risk of sudden cardiac arrest, as well as stopping the disease from getting worse, can all assist a patient in living with cardiomyopathy. How to prevent cardiomyopathies? We have to tell patients to reduce their stress levels, avoid alcohol or cocaine use. They must obtain adequate amounts of sleep, manage their hypertension, and that comes with early detection of hypertension, which is also known as the silent killer, and implement exercise and diet control methods. Exercise is extremely important. Is a house for love, and I've learned that it don't take much to give. Do all you can to take care of your heart. You only get one, because if you don't, it's very possible that this could be you.
Big wiggle, effort.
Go.
Just down.
All the way down to his shoulder blade. To his shoulder blade. All the way down. Go. Get back.
Get the clamp. Get the strip spreaders.
Get the scissors. Mayo scissors. Let's open the.
He needs a bigger knife.
Go in between the ribs with the mayo scissors.
The thoracotomy tray.
Get the thoracotomy tray. Let's go. How much?
On the bottom left.
There it is.
Where is it?
Over there. Rib spreaders right there. Grab those. That big
Get that
tube
tube out.
You have to pull that tube out. Here, bring it.
Pull the tube out, yeah.
You're right. I know, but he doesn't have space here.
Just take the left arm, pull it up over his head, and tape right there. Somebody give me a big piece of that yellow spongy tape. Big piece of spongy tape. The 3-inch tape behind you, Max.
That's the wrong way.
Wrong way.
Go ahead.
Yeah, put the handles
Okay,
down.
still want to open it up because he's bleeding on the right chest.
Go ahead. Clamp on.
Big tape around his head. Take his left
you got the
hand
big
to the
hand?
top of the stretcher.
You got the big clamp?
Right there. Tape it down right there, Matt. Stephanie, bring you a tape.
Take it on across. You're going to have to go right on across up there. Open that chest up.
Big wiggle, effort.
Go.
Just down.
All the way down to his shoulder blade.
These are my references, and that concludes my PowerPoint.